coming up.
Thank you. Dr. Tam, what's the current thinking in terms of whether there's a significant difference in the ability to transmit COVID-19 between a vaccinated and unvaccinated person in Canada? And I'm thinking in
quick question for Dr. Tam. Am I correct in hearing that you said 3 doses of the vaccine is about 60% effective?
And I'm going to help the Conservatives out with this because they want our secret formula for those who don't have kids and don't know SpongeBob. In SpongeBob works at the Krabby Patty.
This guy's garage. Like and subscribe.
Thank you. Dr. Tam, what's the current thinking in terms of whether there's a significant difference in the ability to transmit COVID-19 between a vaccinated and unvaccinated person in Canada? And I'm thinking in terms of the Omicron variant that's prevalent right now.
Just thank you for that question. And I think Omicron was a game changer, is a game changer. Prior to that, 2 doses of vaccine, for example, had a very high efficacy against infection and therefore transmission, as well as severe outcomes. When Omicron came along, 2 doses really waned over time in terms of protection and had a really decline over time to 20% or less after 6 months in terms of protection against Omicron. So it is an immune evasive variant, but 3 dose does give you a boost back up to 60% on average for protection against infection.
Dr. Ellis, please, for 5 minutes.
Thank you, Mr. Chair. A quick question for Dr. Tam. Am I correct in hearing that you said 3 doses of the vaccine is about 60% effective?
Thank you for asking for that clarification. So 3 doses of vaccine against infection and symptomatic disease, when you begin soon after you get that 3rd dose is about 60%, but the studies range in their estimates. And for severe disease is over 90%.
It's interesting, Dr. Tam, it's just a comment, but for varicella, the mortality rate about 21 people per 100,000 in adults, and a very, perhaps more effective vaccine was supplanted by another. So I find it unusual we continue to recommend this vaccine that's very poorly effective. Anyway, that being said, interestingly enough, masking mandates are stopping in Ontario on public transit and in also other various healthcare settings except long-term care homes. So I wonder, does Dr. Moore have some metrics that perhaps he needs to share with the Public Health Agency so we could have some numbers here? Would that be helpful to the Public Health Agency of Canada?
So I would answer that the requirements for domestic transportation is in the domain of the Minister of Transport. And whether someone requires you to wear a mask or not, I would recommend that people add on that layer of protection, especially if the viral activity is high in your area, whether someone's requested it or required it or not.
So, Dr. Tam, are you suggesting Dr. Moore is wrong?
I didn't say that. I mean, in terms of the local jurisdiction, they will know more than I do about the disease activity. But for the general population, I still advise people that to layer on that protection, particularly if you're at high risk, and to protect others.
Interesting comments. Thank you for that. Mr. Chair, to Dr. Tam again, if I could. We talked a lot about metrics and numbers, and I guess I have a very pointed question. What is it that makes the Public Health Agency of Canada afraid to share those numbers with Canadians? What are you afraid of?
I think it's a question of people need to understand the complexity of public health decision making, and you cannot make these very complex decisions based on a singular metrics. The decision makers have to take into account a number of metrics. Even looking at healthcare capacity, that is different across Canada. It's not the same between Yukon and Ontario. And as the federal government, they need to take into account and make sure that they're protecting all populations across Canada with some of the mandates that they are responsible for. So you have to look at a composite picture of all of those metrics that or measures that Dr. Hapicocha had mentioned. It's not that simple. So you cannot boil down a complex decision by simple metrics, but all of them are important.
Yeah, Mr. Chair, thank you for that, Dr. Tam. Mr. Chair, if I could, oddly enough, we've asked for those metrics to be presented here at this committee, and again, not to be disparaging to my other colleagues, but there are 3 physicians on this committee, and again, Public Health Agency of Canada has refused over and over and over and over and over and over again to provide these metrics. I would dare say that perhaps, 3 physicians might be able to understand this very complicated stuff that you're talking about. I find that utterly shocking, dismissive, and quite frankly, unbearable that you continue to refuse to provide this. And there has to be some metrics, Dr. Tam. I mean, this is utterly ridiculous, and to not provide them to this committee is quite frankly embarrassing.
As far as I know, the Public Health Agency, as part of the remittance from the last committee, provided the answers that this committee was looking for, and the president of the agency has...
I'm sorry, Dr. Tan, that's absolutely untrue. I'm the one who requested that material, and the stuff that we got talked about, the same foolishness, and I'm sorry to be disparaging to Dr. Kochar and to the minister, but the same foolishness that we hear over and over again, that vaccines are very helpful. Yes, they are. We're fine with that. Tell us the metrics. Simple. Unbelievable. This is unacceptable, Dr. Tam.
Dr. Tam, you go ahead and respond to that, and then we're going to move on to the next questioner.
I think the metrics are what they are. We're looking for specific numbers, and it's actually really difficult to do that because you have to take into account all of those metrics at the same time. And I think they do include what I've actually talked about, which is vaccine effectiveness, of course. So the current 2-dose vaccine regimen is not enough. And so as chief medical officers, we said up-to-date vaccination is what we recommend. And the other metrics, if you were looking at it, would be the pandemic activity across the world. The United States still going up. Canada, the current wave has come down. That's great, but hospitalization is still high. And it depends on where you are. So I believe those kind of information had been provided to this committee, but we can certainly follow up.
And I'm going to help the Conservatives out with this because they want our secret formula for those who don't have kids and don't know SpongeBob. In SpongeBob works at the Krabby Patty or the Krusty Krab, which is famous for its Krabby Patties. And as anyone who watched the show knows, Plankton is always trying to discover the formula behind the Krabby Patties. And I think the Conservatives are convinced that we have a secret formula as to when we're going to end the mandate. So for example, when the COVID viral count in wastewater falls below, say, 10 viruses per mil, I'm just making these numbers up, immunization rates with the 3rd dose is above 70%, when prevalence in the population is below some other level, and where hospitalization is less than some specific number. Now, let me ask Dr. Tam, I think you've already said the answer to this, and the answer is no, there's no magic formula, but also, isn't it important not only the absolute numbers, but how they're trending in terms of if the rate of using of masks is decreasing, if social distancing is decreasing, if vaccination is plateauing, if availability of treatments is increasing? Is it not an interplay of all these things that makes giving specific numbers impossible?
Yes, that would be correct. And also, one has to look a little bit further ahead in terms of projections as well. So while disease activity may be low at one point in time, we know how this virus is mutating. And so you also need to plan ahead. And I think the government or the ministers are thinking through that as well, because the moment you drop the mask mandate and then the next week something increases, is very difficult policies to reinstate, quickly. And so from an implementation, but also a protection of the traveling public or the workforce perspective, constant shifts in policy are very difficult to manage as well.